Having looked last week at briefly introducing play therapy, this week I would like to begin by looking at skills that the play therapist needs to use within the play therapy sessions itself. We will, in the week that follows this, start to look at how to conduct a play therapy session, and later on also look at different techniques. But just as we saw in our conducting interviews with families, that there are essential skills that one needs to use before we get into the real meat of conducting a play therapy session, I would like to look at two essential skills that, if we get right, will really help us conduct effective sessions. And these are the skills of active listening and observation. If then we first consider active listening, here the counsellor wants to gain information through two ways, namely listening and observing. The function of active listening is to help the child to tell their story and to identify their troubling issues. And in order to achieve this, the child must feel validated that we are listening to what he or she is saying and bringing into the play therapy room. Active listening consists of four main components, which we will further expand upon in the slides which follow. They are matching body language, the use of minimal responses, the use of reflection, and the use of summarization. If we then consider matching body language, here the aim is to match the child's non-verbal behavior. Matching is useful in that it helps to give the child a message that the counsellor is listening attentively. It must be done in a way that is natural and comfortable, and we don't only match the child's body language, but we also match the speed of the child's talking as well as the tone of the voice. And why essentially do we do this? It is because that when we match a child, the child will feel like we are joining with them, and after a while, the situation can be reversed, and here the child is likely to follow the counsellor in significant changes. If we then turn our focus onto the use of minimal response, this is something that happens automatically when we are predominantly listening rather than talking. And as we know that listening is a skill of a therapist, because especially when you're nervous in the beginning of conducting counseling sessions, it's often easier to fill up the room with words rather than taking that step back to listen. When we use the skill of minimal response, we indicate to the child that we are indeed attending. Examples of verbal minimal responses include things like aha, yes, okay, right, etc. And it's important that we do keep them to short, because when we do this, we encourage children to carry on telling their story, and it shows that we're listening. Where if we had to respond with long sentences, the child might feel like that we are interrupting and feel like we're not wanting to listen to what they're saying, and might then shut down and not want to continue on telling their story. It's important that your responses also mustn't be influenced by the perception of the counsellor. We don't want them to be seen as responses that are given to either show the child approval or give disapproval. So we shouldn't say things like, oh wow, etc. Or it's rather important then to keep them neutral to things, as I mentioned, like the yes, okay, and right. And it's also, when you conduct your minimal responses, is to make sure, remember, that it must be natural. So here we need to space them appropriately and not use too many or too few. If we consider the use of reflection, the prior two skills, matching and minimal response, really set a climate in which the child gains a sense that the counsellor has joined with and is attending to him or her. However, the child also needs assurance that the counsellor is attending to the content and details of the story. And here, the skill of reflection is an invaluable tool. There are two types of reflection. Reflection of content, where here we use the skill of paraphrasing, and then also the reflection of feelings. When considering the reflection of content, here the counsellor would pick out the most important content details of what the child has said, and then expresses them in a clearer way back to the child. This also intensifies the child's awareness of what has just been said. In terms of reflections of feeling, here the counsellor is reflecting back to the child information about emotional feelings that the child is experiencing. It's important to know the difference between thoughts and feelings, and it's important to help children deal with negative and uncomfortable feelings too. Feelings are seen clearly also through non-verbal communication. So for instance, if a child keeps on hitting a teddy bear aggressively, we may then reflect to the child that it seems like you're expressing feelings of anger. Another skill that we can also use is that of summarizing, and this is in the reflection process. Summarizing reflects back to the child that information from a number of statements the child may have made over a period of several minutes. Summary draws the main points and also takes into account the feelings. It also enables the child to put a lot of confusing information together to create a clear picture. And remember, the difference here is paraphrasing is putting what the child has said into your own words and reflecting it back to the child, whereas summarizing is reflecting back to the child information that has been stated. We will now place our attention onto the skill of observation, and here we will look at observation in terms of general appearance, behavior, mood of affect, intellectual functioning and thinking process, speech and language, motor skills, play, and the relationship with the counsellor. In observing general appearance, here we would look at, first of all, the way a child is dressed. We will also consider the child's level of alertness and note any obvious discrepancies from normal. For example, if the child is always lethargic when they come into the play therapy room. We will also look at information with regards to physical development and also look at the level of nutrition. Is the child very skin and bones? Is the child increasing in size weight-wise every time they come? Perhaps they're overeating, and we look at those things. We would also look for any peculiar mannerisms the child may have, for example, facial tics. In observing behavior the child exhibits, we would ask ourselves some of the following questions. Is the child quiet and careful, or are they noisy and boisterous, or aggressive and destructive? Is the child easily distractible, or do they have a good attention span? Does the child try to engage in behavior that is dangerous? Is the child willing to take risks? If we consider then the behavior in terms of the interaction with us as the counsellor, we will look at, is the child affectionate and dependent on the interaction of the counsellor? We would also look at, in terms of the child's behavior, how do they respond to physical contact? Are they defensive? Are they responsive? Or are they searching for contact? Does the child display appropriate boundaries? Does the child show approach? In this, do they avoid tendencies, for instance, by showing initiative and then waiting for cues? And here we would also, in terms of behavior, consider, is the child displaying the use of any defense mechanisms, such as suppression, avoidance, denial, and we would also look for indications of dissociation. In terms of observing mood and affect, this gives us clues to the child's underlying emotional state. If we consider children in general, they can generally be observed to be happy, sad, angry, depressed, excited, and so on. Some children will be observed, however, to show literally little or no emotion and will come across as being flat in effect, while others might come across as being self-absorbed. Sometimes behaviors already observed will get information about the child's internal mood or emotional state. For example, aggressive play may indicate that the child is indeed angry. It is useful to observe changes in the mood during the counseling session and to also observe the child's awareness of their own moods and their level of emotional activity during the session. In wanting to observe the intellectual functioning and the thinking process of the child you're working with, if you're working with a younger child between the ages of 4 to 8, here an initial indication of intellectual functioning can be obtained by inviting the child to participate in activities such as building a puzzle, naming colors, and identifying body parts. However, with an older child, in your general conversation with them, generally you'll be able to point out the ability of a child to solve problems and to conceptualize. And in conversing with them, this will also give you an indication of their level of insight. You can also look at their insights and see where the child is orientated by asking questions with respect to time, place, or person, and recent events. And here would also help you to check the child's sense of reality and organization of thoughts. You can also become aware of any abnormal thought patterns, including the presence of delusions and hallucinations. In observing speech and language, here, by engaging with a child, you'll be able to make an initial assessment of speech and language skills. For example, you might notice that a child experiences frustration at not being able to communicate adequately, or that a child tends to rely mainly on non-verbal methods of communication. You may also pick up that a child's speech is not clear, or that a child lisps, or that the child may stutter. In observing motor skills, here you would think in terms of both fine and gross motor coordination, and these can be observed through the child's involvement with activities in the play therapy room. Here, observe whether the child sits most of the time, or walks, or jumps, or squats, and observe how the child moves in and out of positions. Does this happen with ease or with difficulty? Also observe whether the child appears to be constricted in their physical expressions, or if they express themselves freely in terms of the use of their physical body language. Anxious children sometimes show differences also in their breath control, so take notes of any breath holding, sighing, or gasping. When we consider observing the play of the child, it is important to remember here that children's play differs according to age and development. And because of this, it's important that we as counselors have an understanding of the play of a normal child so that we can make comparisons when we observe. What then are we wanting to observe in terms of play? Firstly, we would look at whether the child's play is age appropriately creative, or is it stereotypical, repetitive, and limited. Here we can see that the child in this picture is embracing very creative play, and that they've put a number of different toys and they seem to very much be engaging with the play therapist. Had this child been conducting limited play in terms of usage of the sand tray, we might have found that instead of picking toys and putting them in the sand tray and really moving them around and telling a story, this child would have rather perhaps just thrown the sand in the sandbox and kept on throwing it out. We would also look at, in terms of observing play, whether or not the child takes initiative. And by taking initiative, I mean here that the counselor doesn't need to be involved in the play, except when they are wanting to influence in it. When the child is able to take initiative, the counselor is free to withdraw and observe the development of themes that arise in the content of play. Other things we may want to observe could be the quality of play, and also looking at whether or not the play is goal-directed, if it follows in an understandable sequence, and whether the play materials are being used appropriately. If we consider whether play is creative or stereotypical, this will very much give us an indication of a child's level of developmental maturity. If we then briefly look back in terms of appropriate play, in terms of age, it's important to remember that the normal play of 3 to 5-year-olds is highly imaginative and creative. And while observing the play of children of this age, the counselor should recognize that the expression of fantasies and themes may well be a developmentally appropriate behavior. And lastly, another thing that we can observe in terms of play is a child's mode and a tendency of affect in play. And this is also an important observation to make. Lastly, what should we look at when observing the relationship between the child and the counsellor? Here we can look in our observations for things such as the child's warmth and friendliness, the ability to make eye contact, their social skills level and predominant interaction style, and all these contribute to information which the counsellor may require during the therapeutic process. As a counsellor, you should also notice whether a child is mainly withdrawn or isolated, are they mainly friendly or trusting, or are they mistrustful or competitive, very negative in their affect, or are they cooperative, and so on. And much of this information can be obtained by observing the child's relationship with the counsellor. And it's important to remember that while the counsellor is observing the child may be starting to tell the story. And if so, the child must be fully aware of the counselor's interest in the story. And here we would then, as we discovered in our previous skill, is we would use the skill of active listening to show that we are in fact listening to the child.